A stroke is a brain attack when the blood supply to the brain is interrupted via a blocked or ruptured artery. It's also one of the leading causes of death in the U.S. Risk factors for stroke include high blood pressure, high cholesterol, diabetes, smoking exposure, obesity, unhealthy diet, and physical inactivity. According to research for younger adults ranging from 18 to 55, the top risk factors for stroke were low physical activity and hypertension. In the U.S., African Americans are at 2 times the risk of experiencing their first stroke compared to white individuals. Older adults experience stroke attacks more, but they can happen to anyone. In fact, in 2014, 29% of the people hospitalized for strokes were less than 65 years old. In addition, stroke is the second leading cause of death and disability worldwide. Research suggests that in 2016 alone, there were 13.6 million cases of stroke all over the globe.
What has the healthcare community done about the problem? California created toolkits for stroke survivors and inducted a stroke registry and CoverDell program in prevention and treatment of heart disease and stroke. At federal level, the CoverDell National Acute Stroke Program is a program that funds state health departments to collect, measure, and track data to improve the quality of care for stroke patients. At the local level, in San Diego especially, UCSD Health provides high-quality care for stroke patients by providing 2 comprehensive stroke centers in the nation.
Patients are also educated on the signs and symptoms of strokes and how to take care of themselves once they are home when being discharged. Additionally, the implementation of educating emergency medicine personnel on how to respond to patients who have strokes, as well as creating programs towards stroke prevention education, has increased the percentage of being able to recognize the signs and symptoms of having a stroke, therefore being able to respond accordingly in dire situations. As to what can be done more, clinically, research suggests that tackling hypertension is key to preventing recurrent stroke attacks for patients. To address hypertension, there are multiple antihypertensive drugs that patients can take, so requesting blood pressure values and vascular risk profiles would be a must to see what approach is the best.
One of the biggest misconceptions of stroke is that adults are the only ones that can get them. 1/4 of all stroke victims are under the age of 65. The truth is, people of all ages can develop a stroke, and health professionals can use information pamphlets to educate people as an act of prevention. Individuals showing signs of stroke must be rushed to the emergency room via ambulance as soon as possible. It is vital for these stroke patients to seek care at rehab centers where physical therapy, as well as speech, vocational, and occupational therapy are used to help the patients return to simple motor activities.
A credible source to access information regarding stroke will be the CDC. The CDC website covers risk factors and provides information on stroke. The CDPH, also known as California Department of Public Health, provides a guideline for healthcare professionals regarding stroke patients. They intended to provide guidance to hospitals that would like to understand various methods used during retrospective chart audits for stroke patients, in particular reporting national quality for a measure and other data elements to the Joint Commission.